In America, healthcare is a promise often broken. Families wait for approvals while clocks tick. Who pays the price when care is delayed? The U.S. insurance industry, a maze of bureaucracy, leaves millions in limbo. This is a crisis hidden in plain sight, where patients become numbers and hope battles despair. Why did you leave nursing for real estate?
My decision to leave nursing was a personal decision. I loved nursing, loved the bedside care. I'd always wanted to do real estate. And I had a sister that actually had a terminal brain tumor, and she was 36 when she relocated to heaven, I like to say. And at that time, it made me realize, seeing her go through the process of, getting weaker and being ill, I just realized most people still have to work when they get an ailment. They still need to work to keep their insurance benefits. And it made me think, do I want to keep working in the hospital for 12 hours a day, 12, 13 hours a day? Or do I want to do something different? So I realized life is short. None of us are guaranteed tomorrow. And so I went ahead and took that leap and signed up for real estate classes, and the rest is history.
How do you find being a real estate agent in the Las Vegas area?
Oh, we have great clients and we have great people here in Las Vegas. So I like to say, you know what, my clients are the best. And then a lot of my clients, believe it or not, were referrals from the hospital and nurses and doctors that I worked with for years. So you build that trust through the years. So a lot of my business has been from that sphere of influence, of working side by side with the nurses for 12, 13 hours a day.
What are your thoughts on the American public's negative view of the U.S. insurance system, so much so that a guy, Luigi Mangione, shoots the United Healthcare CEO, and to many, he's considered a hero?
Well, so let me tell you, working as a nurse, I did bedside care, so I didn't deal with the insurance aspect of that. So all of our patients got great care at that point. Personally, that's as a woman in my 40s, having always been healthy, there was a couple of years ago, I had a little health issue where I finally had to use insurance. And that's where I was exposed to our insurance industry and even the billing systems and the challenges that come along with that. And that's why I feel this is such a great topic today.
Despite your background in healthcare, you also struggled when having to deal with your insurance. Can you go into detail about this?
Yeah, my experience as a medical professional had nothing to do with my personal experience going through the system. And the same thing, I talked to many physicians, and they have the same thing. They're normal patients. There's not much preferential treatment, even for them being physicians. Sometimes you have professional courtesies, but even then, they're very limited. You don't really see that too often.
Can you give me an example of a time when an insurance claim was denied and go into how it impacted your life?
Okay, yes. And with this is stuff I haven't really talked about, but this is excellent, aside from with friends and just advocating. But this is something that people have to deal with on a daily basis. I had a breast biopsy done on a mass that was found, and they denied an MRI. And so anyway, I went ahead and still wanted the MRI, and I was able to ask what the cash pay price was, and I went ahead and did the cash pay.
How many Americans are aware of the fact that you can cash pay rather than going through insurance?
So this is something I discovered. So a lot of people don't realize that the cash pay is an option. And I thought it would be so unaffordable to do cash pay. But come to find out, a lot of times they won't give you the option of cash pay if they know you have insurance. And so I've been starting to ask, what's the cash pay price? And if they know I have insurance, they won't. I don't even know if some of them are allowed to tell you, because that's what I came across. They wouldn't even tell me at one point. He said, well, you have insurance, so I'm not allowed to quote a cash pay price. One gentleman did at the radiology office. And that was after the fact.
Do you think the lack of transparency is by design or a defect in the system?
The lack of transparency. Oh, I definitely feel it's by design. I do feel it's by design. And either way, if it was by design, and actually it could be a defect in the system, but I do believe they're making more by the lack of transparency. And part of the reason why I say this is when I would call, because I'm self-employed now, I didn't know my benefits are vary. And so I didn't know what was covered, what wasn't. Being healthy all my life, I've never really had to use my insurance, thankfully. And when I went to use it, I would call and ask for what price my procedure would be or exam or whatever was ordered. And often I would say, oh, we don't know what's negotiated between you and or between your insurance carrier and our tests. So they wouldn't give me a price up front. Then I would call my insurance and say, hey, how much is it for this exam? And the insurance company would also be vague and say, well, we don't know until they bill us. So then I felt like a monkey in the middle, not being able to get very clear answers.
How did you end up resolving the situation?
So on that, you go through with your tests, you sign the waivers, you agree to whatever you're agreeing to on the forms, and I would get the bills. And so I couldn't resolve them until after I got the bills, unless it was for a procedure where they did get pre-approval for a clinical for the facility. See, I don't know how much to go into.
Can you give us a few examples of when you needed healthcare and how it turned out?
Just in the past couple of years, there were a couple things that have come to surface. So women in their 40s, this is so important for women to know too. If you're drained on energy, have your labs checked. Don't wait until you feel healthy again. I was waiting to feel healthy and come to find out I had iron deficiency anemia. And I didn't know that because it was just a slow, gradual progression where I was losing energy and I wasn't able to do my normal tasks and athletic activities that I enjoy doing. And I found out about the iron deficiency by getting my tests done. But then that's when I was exposed to our medical care and the deficits or defects in our insurance industry. And also another time for a benign breast biopsy that a lot of women have.
The words delay, deny, depose were found on Luigi Mangione's bullet casings. What do those words mean to you in terms of your own experience with insurance?
First, I don't approve if murder is not an answer for anything. So I don't understand how there's any rationale there. For delay, deny, depose, I'm sure people do experience that. I've had that with I received over a year later after a procedure, I received an anesthesia bill it was maybe $800, $700, $800. And this was over a year after the procedure. And they were billing me this when I had thought I had already paid all my bills. So that would be the delay. And then deny, I guess they were saying the insurance didn't cover this anesthesia bill. But when they called me before the procedure, they told me it was all inclusive for the $1,200 deductible that I had to pay. So I was informed that everything was inclusive, but then they delayed the payment. Here it's a year later, I'm getting this bill. So then again, it brings up the stress level of I thought everything was paid. Now I'm having to make calls again. And that became a tedious process where you don't get anywhere a lot of times by making the phone calls.
So essentially, when you needed to focus on recovery, this situation actually caused you more stress.
Exactly. Well, thankfully for me, because I was healthy, I was post-recovery. So that's the beautiful thing. But there's so many other people that are sick and they don't have the energy or the time to be researching all these bills and explanations of benefits that they're receiving, and they don't know what to make of it. I've had to learn and teach myself through this process.
A 2023 Premier survey found that 15% of initial claims are denied, but 51.7% of appealed denials are overturned, costing providers $19.7 billion annually. As a nurse, did you see this impact families at all?
The good news is for us, and I worked in the bedside in the intensive care unit. I didn't do case management. So case management probably saw a lot more of the denials and the billing. I did not. And then a lot of our patients were elderly in surgical ICU. Our patients were elderly. So a lot of them had the Medicare, Medicaid benefits that covered the majority of what they were, in the hospital for.
The Fair Credit Billing Act allows consumers to dispute erroneous medical charges, but complex appeal processes deter many, with only 14% of denials appealed per KFF. When you personally faced a claim denial, did you attempt to appeal it?
I did, yes.
What was the process like, and what advice would you give others in a similar situation?
My advice would just be to take deep breaths. You're going to get through it. There's always another solution. So you just got to focus on the solutions. And if they deny one thing, they might order a different test that they can justify. And so that's the thing. But it is possible that maybe you didn't need that test. I'm not saying that is the case, but I know with my situation, I wanted the MRI when I had a benign breast biopsy completed. I wanted the MRI. I could have probably gone without it. But since I had never had previous health issues, I wanted to make sure I was doing everything possible.
What changes do you think are needed to restore trust and fairness in the U.S. healthcare system?
Ooh, that's the best question ever. That is so great. So the changes that are needed is transparency in our healthcare system. Anyone should be able to call the radiology office, the doctor's office, and say, hey, how much is this test? How much is my appointment? They shouldn't be put on hold and say, we don't know until your insurance, we know what's negotiated between your insurance. It should be sort of flat across the board. It should be fair for everyone. The other thing is insurance companies. They should, if you call your insurance company, it should be the same thing. They should be able to tell you. You shouldn't be feeling like you're going to, it's almost like going to a restaurant with no prices on the menu. That's how I felt. I felt I was going, they're ordering for you because they're doing the tests and you don't know what your portion is when you come out. So it definitely raises your stress levels in addition to those who may already be sick. They could be more ill or have other ongoing issues. Now they have to worry about their finances. And for people that do to maintain great credit and, where they want to make sure everything gets paid, this does become an extra stressor for them, especially while they're dealing with health issues.
How was insurance when your sister was going through her medical issues?
So one thing I would love to tell your viewers is pretty much anytime you are ill or you have a loved one that's ill, you have to be your number one advocate. So that's the thing. Just know that. Thankfully, my mom took care of my sister's care because there were so many recurring charges that her insurance company did give us our own case manager within the insurance company itself. So that case manager was sort of our advocate also. And so once they know someone that you're following up and you have questions, she did a great job advocating for us. And my sister did have a good insurance. So we're thankful for that.
You've discussed negative insurance experiences and positive ones. What's the best way to determine if you have a good insurance company?
This is the thing. So insurance companies are difficult to say because you don't know what's covered until after you need it. So I've had to learn this even being self-employed. In the hospital, I got the hospital insurance benefits. And at the time, I think they were fairly decent. And then I was healthy, so I really didn't need to use them. But they had lower deductibles. Now being self-employed, the deductibles are higher. And a lot of times what they cover and what they don't, I don't know until I have to go use it. So that's where it is a challenge for those that are self-employed or getting their own personal insurance.
Can you tell us about the No Surprises Act?
Every place I went to had sent me bills that were not accurate. They were mischarged. I got was it $1,500 radiology bill for a test that was never ordered. And so and then come to find out the test was never even done. And it was never ordered, it was never done, but they're sending me a bill for $1,500 saying it's not covered by my insurance. They even processed this bill through my insurance. And they said that's what I had owed. So I had to finally, after calling the different numbers for that radiology place, they would say, oh, we don't no longer service that. You need to call this number. I call that number and it'd be the same thing. They'd refer you to the other number. So there I felt like monkey in the middle again. And finally, I called the director. I tell people, go to the next level. Call the regional director of that radiology department or whatever medical office that is. And thankfully, the regional director did give me a call back and she researched it further. Come to find out, the test was never ordered, the test was never completed, and they finally removed the bill. I wrote them a letter and I told them that violated the No Surprise Act. I was never informed I'd be paying this anesthesia bill. I thought they told me it was all inclusive in the facility charges and my deductible. If there's a bill that they want to refute, send a letter to your insurance company, usually, or the biller, I should say. It's usually the for me, it was the anesthesiologist, but your doctor's office or the facilities that are sending you the bills, send a letter.
From nurse to real estate, through insurance battles and personal pain, Marthea Jaffe became an advocate. Her story isn't the end. Across the globe, people demand better healthcare. What's your story? Share your insurance experiences or reform ideas in the comments below. Your voice can spark change.